Hello, everyone. My name is Aaron Everett, and I've done my digital research project on Achilles tendon injuries in runners. So, to start off, to kind of give a basis of what I'll be talking about, I'm going to dive into what the Achilles tendon is. The Achilles tendon is located posteriorly on the lower leg and connects the gastrocnemius and soleus muscle groups of the calf to the heel of the foot. It is composed of collagen and elastin fiber, which is common for most of the tendons in the human body. Its functions allow for transmitted stabilization of the lower limbs through pressure, producing force through plantar flexion, walking, running, and jumping. And although it is the longest tendon in the body, it is more susceptible to injuries than most other tendons because it is used so often. Causes of Achilles tendon injuries in runners include overloading during workouts, which usually means a runner has a really high running volume that's too high and they're pushing their body past its limits and putting too much stress on that tendon. Severely tight calves can also play a role in producing a lot of stress on the Achilles tendon, which is why it's really important to stretch before you run. And violent and explosive movements can also produce stress and pain in the Achilles tendon. This is usually seen in sprinters as they're usually hammering at the ground really hard when they're coming out of blocks. Block starting would be an easy way, if done too many times or done a lot over times, could prevent or could cause a Achilles tendon injury of some sort. There are three common types of Achilles tendon injuries in runners, them being Achilles tendonitis, Achilles tendon rupture partial tear, and Achilles tendon rupture full tear. Some signs and symptoms of Achilles tendonitis would be pain and stiffness, typically like after the morning after like a run, it would occur. And then you have pain in the tendon, like while you touch it, you tap on it, it hurts. Too painful to stand on the toes of the foot. This usually involves getting like a calf raise, getting full extension. Typically, someone with Achilles tendonitis will not be able to get full extension on a calf raise or stand on their toes because either their Achilles will lock up on them or it will be too painful for them to perform the motion. And then just a general irritability and pain while walking or running. Then there are two types of Achilles tendonitis, being non-insertional and insertional. Non-insertional Achilles tendonitis, the fibers in the middle portion of the tendon, kind of above where it attaches to the heel, are affected, and over time the fibers begin to break down and develop tears, and this can lead to tendon swelling and thickening. And non-insertional tendonitis is a lot common in younger runners. Insertional Achilles tendonitis occurs at the insertion point of the tendon and the calcaneus, that is the heel bone. And in both non-insertional and insertional tendonitis, the damaged tendon fibers could possibly calcify, which means they harden over time. And this is how bone spurs often form on the heel and protrude out. And insertional Achilles tendonitis happens in a broad range of people, not just younger runners. And insertional Achilles tendonitis specifically develops from calf muscle tightness. And this is the calves are tight and it's increasing a lot of stress and pull on that Achilles tendon at the insertion point. Then Haugen's deformity is a type of bone spur and is a condition where there's an enlargement of the bone on the back of the heel and it comes out and it rubs up against the Achilles tendon and causes inflammation and pain. And then treatment for this would be the Rice protocol, which generally states you rest the Achilles tendon, you ice the Achilles tendon when it begins to show signs and symptoms, you compress the Achilles tendon with a brace or a compression device, and then you elevate the Achilles tendon so the inflammation and swelling goes away. On the left, we have an example of non-insertional Achilles tendonitis with the inflammation being in the middle of the Achilles. And then on the right, we have an example of insertional Achilles tendonitis with the swelling and inflamed area being at the base of the heel. An Achilles tendon rupture can either be partial or full. If it is partial, that means it's still intact. And if it's a full rupture, that means it has been severed completely in half. And this can be determined by using a Thompson test, which means the person administering the test will squeeze the calf of the individual
And if the foot twitches while squeezing the calf, that means that the tendon is still intact. However, if it does not twitch, that means the tendon is not intact. And this can also be seen, as in the next slide I'm going to show, but there will be a gap or a divot in the Achilles that is visible and physically, can be felt. And individually, like symptom-wise, it will hurt to apply pressure with that individual. They may have heard a popping sound or felt a popping sensation in their lower leg, and they will not be able to generate any force with a plantar flexion motion. Treatment will involve surgery, some kind, with a recovery and rehab plan or program implemented. In terms of how sports ruptures are gauged with other sports, in the running world, uh, running injuries fall into the other sports injuries category and are tied with football for the third most sports-related ruptures. These are two examples of Achilles tendon ruptures where they're visible. As you can see, the divot on the first picture is pretty severe. And in the second picture, where the arrow is pointing, the darker spot in the kind of upper region of the Achilles tendon also shows a full tear. A physician usually looks at the Achilles injury and determines whether or not surgery is appropriate or not. And if surgery is needed, then the recovery outlook will start with the person being in an adjusted boot. And this will happen from 6 to 12 weeks. They will be non-weight bearing for this period. And the adjusted boot is tilted in a downward position and gradually brought up into a dorsal flexion position to grant the Achilles healing time. A heel lift is also later implemented depending on the person's progression with walking, and no running will be allowed until a 6-month period has been hit. Rehab usually involves physical therapists helping regain the range of motion of the foot and ankle, as well as regain the strength of the Achilles with various exercises. So there are several ways runners can prevent Achilles injuries. One of them being warming up and stretching properly. Doing proper calf stretches before extreme workouts can decrease the risk of developing Achilles injuries. In addition, having access to proper footwear, depending on the person's foot, can also help. Making sure that they're not putting too much pressure on their Achilles or wearing it out over time. Calf strengthening that's implemented into different running workouts can also help decrease the likelihood of Achilles injuries, because when you're working out your calves, you are in turn working out your Achilles as well, making it stronger. And lastly, proper recovery, making sure you're getting rest time, not overworking yourself, can also reduce the risk of Achilles injuries. The Achilles tendon is the thickest and strongest tendon in the body naturally, capable of producing 4 times its own weight. It should be utilized and treated like a runner's best friend. This is why I believe it's important for runners to prioritize and take care of their Achilles tendons, because without the Achilles tendon, well, runners would not be able to be runners. Thank you for your time.